the Oregon Prescription Drug Program was established as the only purchasing pool for prescription drugs. And then shortly thereafter, and shortly meaning 3 years because that's short by state standards, we have a partnership beginning to form with the Washington Prescription Drug Program, coming together to form what I've already talked about, the Northwest Prescription Drug Consortium, bringing both states' lives, both states' purchasing power together. Through that partnership, we, through appropriate procurement practices, found a master administrator, if you will, in MODA that would help us expand participation in 2007. Then future things happened legislatively and programmatically, and by 2010 we'd expanded the scope of our services to include Medicaid, Medicare, group purchasing organizations, different 340B solutions, and MODA again was selected to administer the program. And by 2013, we had a full-scale GPO solution in place, as well that included a non-traditional solution that we currently use for Oregon Educators Benefit Board.
Trevor,
yes,
what
absolutely.
GPO stands for?
Group Purchasing Organizations.
Okay, great. Thank you.
You bet. Thank you for chiming in. Then by 2015, it became very clear that Medicaid was able to participate within OPDP, and CCOs would be allowed to utilize OPDP services to help them better manage the program. Eastern Oregon CCO has indeed embraced that opportunity, and others are currently contemplating that move as we speak. In 2016, there was a contract extension that extends the agreement through the end of 2021 with MODA as the administrator of OPDP and WPDP in the consortium. And as of today, we serve roughly 1.1 million people, as I said, and have facilitated more than $800 million in drug purchases across the two states with respect to groups and facilities in both states. So that's kind of the history, and the next slide is demonstrative of where we've come from. So if you'll see the total enrolled lives, that it looks like a nice steady curve upwards to enroll more and more people as we've gone along in the last 10 years. So and that kind of points to the 1.1 million lives that we presently have and where we came from in 2007. We're excited about where we're going in the future as well, and to kind of give you a picture of what the two kind of, well, let's say 3 buckets of work that the programs do. I've put this slide in. What this slide attempts to do is it tries to share with you the discount card lives, the employer group lives, and then the facility lives to give you an idea of what the program is doing in both states. So you can see there on the far left, there's the discount card, which I'll talk more about later on in the presentation, and then you have the employer groups, which I've already touched on and we'll be touching on in greater detail here in a moment. And you'll see that it's a discount card, Oregon has a little bit of an edge. With employer groups, Washington has a little bit of an edge. And then with the facilities, Washington's also been able to grease the skids a little bit more than Oregon has to date. So that's kind of what that slide's for. So who do we serve? Like, who are these groups? Well, you may recognize some of these folks. SAFE Corporation is, probably in the bottom right corner there, is probably familiar to most folks as the workers' compensation quasi-government insurer. You're probably familiar with PAD and OAD. I mentioned EOCCO. And some of the, and then Oregon State Hospital, hopefully folks know about that too. But you'll notice that there's Washington entities on there as well. And so the Uniform Medical Plan is basically the equivalent to PAD in Washington. And so that's just giving you a picture of who it is that we serve. And the other thing that I think it's important to just recognize is that all of these entities have different needs. And so when we put together a pharmacy benefit management option, we want to be sensitive to those needs. And as you can imagine, with a work comp carrier versus a group health plan, there's probably substantial differences to what those services might look like for an insurer. And I think that just goes to show you how flexible and how good of a job that MODA does for us in making sure that we meet the needs of each individual participating entity and desire to provide that top-notch service to the plan and then also ultimately to the member. So let's talk a little bit about how we do that, and that's what the next little section of this presentation is about, is the group pharmacy benefits management offering. So this is the most famous phrase in the world of healthcare, at least in Oregon, the triple aim. So essentially, we recognize that there's different needs, as I said, and we want to make sure that we support our entities, whether they're an employer group or a government entity, to achieve the goal of lowering cost, making sure that the outcomes they're targeting are coordinated with the efforts that we're working with them to achieve, and then making sure ultimately that the experience that the person that we're serving is very, very positive. So what we do is basically give the crown, if you will, or the scepter, to the participating program. That's at the top of the screen of this slide. And through the oversight of OPDP, myself, we sit down with the participating member. Usually MODA is very, very astute listener, and we have MedImpact joining us as well at times, who serves as the pharmacy benefit management organization that helps ensure we have adequate pharmacy network and that the claims that get submitted on behalf of a member get paid to the pharmacy so that the person can ultimately receive the medications that they need. And essentially, we design what it is the participating program at the top of that slide needs, and we build a very customized approach to help make sure that the participating program's needs and desires are met. Some people ask, why all three of these folks, and what does that mean in terms of what do we get from each of these entities? So first of all, in the Oregon Prescription Drug Program, you get me, and you get the oversight of the interstate consortium as well. So both states oversee the contract we have with MODA and ultimately direct the work that they do. And MODA's the administrator of the program, making sure that the participating entities receive that best-in-class experience that I have already articulated. And then also the work of MedImpact, as I suggested, operates under the direct supervision of MODA. So together, we really want to make sure that our participating programs have the autonomy that they deserve, experience the savings that they also are seeking, and back it up with experience of a very, very robust administrator and pharmacy benefits management organization. So that leads to the next slides that kind of hit on those things that I talked about, the autonomy, the savings, and the experience. And so obviously we want to make sure, as I've already pointed out, that we're flexible and we want to meet the needs of the program. We want to make sure that the choice of pharmacy networks is available to participating entities. Some, as I already pointed out, recognize that we can customize the program to meet the needs and most importantly, the goals of the organization and participating entity. We also are collaborative, and we want to make sure that we can offer whatever services that we need to support our participating programs. And then we can adapt reporting, and we're in the process of actually developing report cards, if you will, for our participating entities, which will also be very, very helpful. This moves us on to savings, and this is really key. And I mean, I don't think there's anybody out there right now in the world of pharmacy that doesn't want to save money on their pharmacy spend. I mean, everyone is talking about the growing price of pharmaceuticals, and I think that we have a unique and outstanding offering. We have a 100% pass-through agreement with MODA and MedImpact. That includes all pharmacy costs and rebates that are collected. Anything that is collected from manufacturers and the costs associated with cost savings associated with dispensing, it's all passed down through to the participating entities 100%. So it's and the other thing too is the administration costs. So there is a cost associated with providing the service to group health plans, but it's fixed. It's a flat administration fee, so it's predictable for the participating entities. And the other thing too is we have established performance guarantees in terms of what pricing looks like. Since I've been on board, we have outperformed those guarantees, and before that, we also outperformed those guarantees. And all of that outperformance, it goes back to the participating programs. So the actual projected savings on the front side, based upon a guarantee, it looks good, and it makes it look even better when you go retrospectively back and look and say, oh wow, we didn't just meet the guarantees, we exceeded it and saved millions of dollars more. The other thing that's important to note that we also have most favored nation status. So our contractors and the subcontractors for the consortium offer us their best possible price. We are the most favored nation, if you will. No one can get a better price through those organizations than us. Another thing that we also do is we have a third-party audit every year. It's called a market check, and we make sure that we're competitive. And last year's market check has come back and has indicated that overall we're competitive with the market, comparable to groups our size. And there were some areas that were outlined that needed some attention, and we've already addressed those issues with MODA together to make sure that we are indeed remaining competitive within the market. And then we also have the obvious assurances in place to make sure that performance is being sustained at appropriate levels. Pardon me. And then I think that it's important to just call out that there is a vast network of pharmacies behind the Oregon Prescription Drug Program. 56,000 pharmacies nationwide. Pretty much every pharmacy in Oregon, with the exception of Walgreens, participates. In addition, we also make sure that rural areas are captured, and we work with the Office of Rural Health to identify critical access pharmacies and make sure that reimbursement is appropriate to sustain the operations of those valuable resources in frontier areas, I guess, or rural areas of the state. And I think that it's important to just recognize that we also have a very strong local specialty pharmacy. Arden Specialty Pharmacy is located in Portland and was named Specialty Pharmacy of the Year last year. And they do outstanding work for us, and should members need access to specialty pharmacy services, Arden stands ready to deliver excellent service out of their Portland location. And I think that it's also important to recognize that there is access to clinical pharmacists and medication support, should that be selected and needed for participating programs and members receiving services. So to wrap up, we have basically a three-pillar approach that really targets those three areas that I outlined to essentially strive to a place of perfection in the pharmacy management services for our participating programs. And that's what our mission is. With that perspective, I included on this slide a little bit of language from the annual market check, just to demonstrate that there's, we are indeed competitive, and it gave us some other ideas of what to look for and what we needed to do to improve, and we've already taken action, as I indicated.
Hey, Trevor,
So,
at the risk of opening up a can of worms, why doesn't Walgreens want to participate?
So good question. I think it's fair to ask. I don't think it's a can of worms. Every pharmacy has to make a business decision of whether or not they want to come to the table and play or not. Interestingly, a couple years ago, Walgreens decided that it wasn't something that they wanted to do. However, more recently, there has been some telephone calls being made to me asking to come back to the table. So I don't think you've heard the last of Walgreens.
Good to know. Thank you.
Yeah. So I kind of wanted to pause there too, and just kind of, because we're going to transition now to the discount card. And I kind of wanted to give everybody a chance to get caught up on the group health employer based services that we offer. Any questions so far?
So this is Donna at the state office, and I guess I wasn't really aware that there was even that option that group health organizations benefited or could participate in this program. So that was very new information for me. We as SHIBA counselors statewide do interact or promote the discount card pretty regularly, especially when we have beneficiaries, Medicare beneficiaries who haven't enrolled in a Part D plan, or who have enrolled in a Part D plan and they're looking to maybe avoid the coverage gap, and they need to take a few of their meds off of their insurance card, and we point them to the discount card instead, because that doesn't go towards their calculations in the different stages of their Part D plan. So mainly that's what our SHIBA counselors are involved with when we are counseling somebody who is on Medicare or approaching Medicare for their prescription needs.
Outstanding. Well, thank you very much, folks, for promoting my program, and I really value that connection. If there's anything that we can do to help you, let me know what that is. So any more questions? I can keep on going if not.
We don't see anybody who's raised their hand, so yeah, keep on going.
Yep, good deal. All right, so everyone should know about this website. And when I say everyone, I mean everybody in Oregon. opdp.org will bump you over to this wonderful website that you see pictured here on this slide. And that website provides a number of things that you can, I'll explain a little bit later, but that's how you get people in touch with the program first and foremost. So how does this discount card program work? It's 100% cash payment by a member, and purchases are not subsidized by the state. So that's important to recognize. I was just in Pendleton a couple of weeks ago, and a lot of folks were under the impression that the state was somehow using taxpayers' money to offset the cost of prescriptions for low-income folks. This is not the case with the Oregon Prescription Drug Program. It is totally a discount card program that is funded by the person who holds that card. So 600 Oregon pharmacies have chosen to contract with the consortium statewide, which means that those 600 pharmacies all take the discount card program. And, we, as you have already explained, you need to register for the card and make sure that you have that, and then take it to the participating pharmacy, and the pharmacy can process that discount for the member. One thing that is another question that I often get asked is, can I use both my insurance and the discount card program? Well, you can't use them both for the same drug, same medicine at the same point of sale, but you could use your insurance for if you're taking 5 drugs, kind of like how you indicated, for 4 of them, and then you could take one of them off your insurance and pay through the OPDP card. And you could also, let's just say you have a high deductible plan, you're a young person, your deductible is $1,000, and you've been prescribed amoxicillin for a strep throat or something. And, you're going to have to pay usual and customary under the insurance because you have a deductible to meet, and it was going to be $20, but with the discount card, it's $7. It might behoove the young person to just pay the $7 on the discount card program and not worry about the $20 that would have gone to their deductible. Save them a little bit of money. So that's, I think, answering most of the questions that I hear right off the get-go. The other thing is people can't believe this, but it's actually free. And anyone, there's no income restrictions, there's no age restrictions, it is indeed free to enroll. And it's worth having. You never know when you're going to need it. Obviously, it provides excellent discounts. We have generic drugs that are discounted as high as 80%, sometimes higher, and then brands 20% off brand name drugs. And the other thing is there's really limited. There's no real limit to what is available underneath the discount card program. All drugs are eligible for some discount. We also have some vaccines and immunizations that are covered, and like I mentioned before, it's good at 56,000 pharmacies nationwide. We also have a postal or a mail order option available for members through Postal Prescription Services, and as I also said, we're happy to have Ardent Health, a specialty pharmacy, available as an option as well for folks needing specialty pharmaceutical products. I have to say that I actually have visited Ardent and taken a tour there. It's an outstanding facility. I'm impressed with the level of care they give folks when folks call in and talk to their staff. It's outstanding. All right, so I already said the most important website you need to know about with respect to the discount card program is opdp.org. We have English and Spanish applications online. Just download the enrollment form or call toll-free. I mean, any way that you wish, you can get us that enrollment. And literally within a week, maybe two, you'll get a card in the mail, and it'll have a nice little pretty logo just like the one you see on that top right-hand corner, and have your name and appropriate information on the card. And then that is the card that you take with you to the pharmacy in order to procure said discount. So again, very simple. That slide there shows what is available on the website. If you need to know where the closest pharmacy is, it'll tell you where it is. It'll actually look up drug prices for you and tell you what pharmacy is offering you that price, and then you can go from there. It provides comparative information too, so like if you wanted to see what the generic cost is versus the brand cost, you can do that there. And I think there's also enrollment material, so for folks that want different flyers and such, we can get that for you through there as well. So that's the discount card website. So let me talk a little bit about where we're at. So as I wanted to try to get some more recent numbers, but this is pretty recent. February 28th of this year, we had 305,407 individuals enrolled through the discount card program. And I just put some stats there for 2017, and you'll see that just for 2017, savings for card members was over $130 million. So that's pretty cool. Actually, I think it's supposed to be 13. Pardon me. There's a zero put in there. $13 million. That would have been outstanding if it was $130 million. That would have been great. So, no more questions there. I think you guys got these to print out too, so you can refer back to them later. So, in summary, we are, a multifaceted vehicle that works across states, state lines, Washington and Oregon. We have both as was already called out, the availability to offer our services to any public and private partner. We're willing to work with anybody and everybody. And I see a question coming in. I'll get to it in a minute. And obviously, we are hearing constantly from the people underneath the golden robot, otherwise known as legislators, the desire to address rising drug costs. And we want to help them do that, and we're constantly looking for other innovative strategies to take this to the next level. And then I think we can probably pause there before we get too carried away into this last couple of slides. Maybe we'll go and read these questions here. So I have, I don't know how to make this question big. Oh, there we go. If an FQHC participates in a 340B program, would signing up for the discount program be helpful, or would they already receive the discount through the 340B program? Good question. So we actually have 340B programs that we utilize for group health members, so make sure that if there's 340B eligible claims, that we make sure that the entity benefits from that. And we develop other programs to make sure that we utilize 340B services when we can to reduce the overall cost. So signing up for the discount card program may or may not be beneficial for a member. I think you're asking about a member.
Trevor, not everybody is familiar with the 340B program, so if you have some information you could share on that, that would be helpful too.
Okay. So 340B is a program that is named for the part of the Public Health Service Law section that it's named after. And essentially it provides special drug pricing for federally qualified health centers, FQHCs, and disproportionate share hospitals to serve what was once a large population of uninsured folks that were seeking services, or people that were underinsured also seeking services within various communities across the state and country. Essentially, it's a federally mandated or federally run program underneath the section of that law. And so essentially it provides reduced pricing under that federal program that are pretty good prices. And what the entity that is designated a 340B entity is allowed to do is it's allowed to charge its usual and customary amount for those medications to people that have insurance or that have the ability to pay, to then use the difference or the delta between what they acquired the drug for and what they actually received for the drug to offset some of the costs that are incurred when delivering care to the under and uninsured population that they serve. Essentially, that is at a high level is what 340B is designed to do. Is that helpful?
That is helpful, and I know I have helped certain beneficiaries that are needing insulin, and they are able to purchase that insulin through their local hospital that is participating in that 340B program.
Yes, yes. Okay, and then Shannon also had, okay, yeah, clients. So Shannon, did I address your question? Is there anything else that I missed there? Okay, thanks. And then is it explain how you make a profit from the program? So how do I make a profit? I don't make a profit, but how do we operationalize the program? Would that be what your question is? Okay.
Yeah, I guess how does it work?
Okay.
You know, I realize that it's a nonprofit organization, but how does it work financially so that you can provide these deep discounts?
Yeah. Okay. So we first of all, let's take it kind of one step at a time. We'll go with how does the Oregon Health Authority operationalize the program? So and how do we do it with Washington? So we obviously have some operational expense and overhead, and we try to be self-sufficient. I also have other duties besides just running this program, so it's not my only area of responsibility. So I have Medicaid oversight responsibilities as well. But what OPDP is charged with doing is making sure that there is some revenue that is coming back to just cover the costs of operating the program. The discount card program builds in a $1.20 charge that is, included in the discounted price that is presented at the time of sale for the member. So there's a $1.20 fixed admin cost that's built into what a member or a card member pays the pharmacy. And then that amount is then allocated to cover the costs of the different contractors on our side. Again, it's fixed, it's predictable, everyone gets the same rate. Under the discount card, there's no different admin costs hidden anywhere else. And then a small portion of that amount comes back to the state to help offset my salary and my operations manager's salary to run the program. So that's how the discount card operates from a fiscal standpoint. Now, as you are well aware, I'm sure group health entities usually pay a pharmacy management company a fair amount of money to manage their pharmacy benefits. And a lot of times these agreements are not transparent. They make money off of the rebates they collect. They withhold overperformance. So if they guaranteed, say, a 5% discount across the board and they achieve 10, they keep the delta of 5 for themselves. It's profit. That's not the case in our arrangement. It is 100% pass-through. So the way we structure things is with an admin fee that is fixed. And within basically 3 tiers presently, we have the flexibility to create the program's service level, if you will, within those 3 tiers, and it's fixed cost for each of those 3 tiers. So if you want, like, the Cadillac, you pay a little bit higher per claim fixed admin fee. If you want the high-end Honda, that's the middle of the road option. You pay a little bit less than the Cadillac version. But if you want the smart car version, that's just going to do the job of getting from point A to point B, that's the base version. Each one of those has some level of customizability, with the base model having the least amount of flexibility. But that's essentially how the program is sustained. We're designing a program to cover the costs of managing this program and doing the work necessary to take the number of lives that we have pooled now and going to those manufacturers and saying, hey, we have 1,000,001 lives now. Give us a better deal than what you gave us last year, because we are also looking at expanding to other states, and that's kind of another thing I wanted to talk a little bit about. As I pointed out earlier, I wanted to kind of share with you some of the things that we are planning and what we would like to see happen in the next within the next 5-year plan, if you will. So I hope that helps explain kind of how things work. GPO purchasing is similar in the sense that there's a small administrative fee charged for based upon a proportion of what your spend is, and then at the end of the fiscal cycle there is a calibration and a reconciliation, if you will, and the actual costs of the program are deducted from that admin charge that was charged, and then there can be a sharing back of that leftover amount based upon agreement to the participating entities. So it's, again, very, very transparent.
Thank you. That was very helpful.
Yeah. So the other thing I was going to talk a little bit about was where are we going from here? I'm sure many of you you experience the same joy I do when our legislators meet underneath the golden robot. And this year was of particular interest. We had a number of pharmacy bills hit center stage, and some of them even passed, 2 of them precisely, and others that stalled in committee. And I'm happy to kind of go over some of those things that connect to this body of work and where things might end up. And so let's start with 4005. House Bill 4005 was the drug transparency bill. Representative Nose championed that bill with Chair Greenlick of the Health and Human Services Committee. And it was well received, had some support on both sides. However, some folks on the other side of the aisle felt that it was not going far enough. Nonetheless, it did end up passing, and at the end in the Senate, Senator Steiner-Hayward was kind enough to provide us with a mechanism to collaborate with some leaders in the pharmacy field to establish an enforceable and efficient way to contain the costs of prescription drugs for all Oregonians. That's the charge. So I'm really looking forward to seeing where that task force lands, and that's beginning to meet this month, later in the month, but I think the 18th of May is the first meeting that they will have. And so that's House Bill 4005. The other House Bill going in order is 4143. It's a governor's bill on the opioid crisis, and specifically addressed three things. One, a report back to the governor's office and the legislature outlining what the barriers are to substance use disorder treatment, specifically calling out access to certain medications in the opioid use disorder and other substance use disorders. And then the third thing it did was open up the door to 5 pilot projects in different counties across the state for peer support workers that are specialists in addiction counseling, to connect those folks to appropriate resources that are coming into ERs and urgent clinics across the state. So that's an interesting couple of projects that I've begun working at least somewhat directly or tangentially with. And then the final bill that I wanted to just touch base on is House Bill 4151. And that bill died in Ways and Means. But that bill actually pushed OPDP's product, if you will, out to all agencies, and tried to make folks aware that this is indeed an option for all state agencies, as well as city, county governments, and also private entities that wish to get in to the discount and the services that we offer. So that's a highlight of kind of where we have gone legislatively. In fall of last year, Governor Brown asked for our organization to participate, or at least apply to participate, in a grant-funded program by the National Governors Association that focused on pharmaceuticals and public health crises. And so as necessary, we applied to the grant on a literally 48-hour turnaround, and we're successful in obtaining the ability to participate in this opportunity, and traveled to Washington, D.C. with Heidi, operations manager of OPDP, and we were able to participate with 12 states, including ourselves, on pricing strategies and networking with other states with respect to ideas. And that has precipitated into discussions with other states about the consortium's work, and the possibility of, if you look at the slide that's up on the screen now, of expanding those gray boxes across the top of this document to include other states. And so that's something that is a possibility and not out of the realm of reality in the near future. So with that, I don't have anything much more other than just to wrap up that obviously from this slide you can see that there are a number of folks served, and we have a nice little kind of vignette, if you will, of services that support and wrap around every part of what it is that we offer. And I'm very thankful for the time that you've given me today, and welcome anybody desiring more information about OPDP to contact me. There's my information, my direct cell phone number. Happy to help you guys any way that I can, and I again can't stress enough how thankful I am to you for continuing to promote our program with folks that you impact their lives very positively. So thank you.
Thank you, Trevor. This has been really helpful. We're really happy that you agreed to come and talk to us. We didn't get as many people on this call as we had hoped, but we do record this, and it will be available on our website for future viewing should people who had scheduling conflicts want to take advantage of listening to that recording. I don't see any other questions that have come up, and it looks like the majority of people are still on, so we'll see if they have anything. Otherwise, we'll let you all go. Anybody? Okay. Well, again, thank you, Trevor. If you don't mind, we might repeat this again next year. We always like to keep updated on any new things that are coming about, and especially as you grow and expand, we want to be able to give that information to our beneficiaries that we encounter. So,
absolutely. I'm happy to come back as often as you need me, and happy to provide whatever support I can provide you. Thank you very much.
Thank you, and have a great day. Thank you, everybody, for participating. We hope you enjoyed this webinar.